team of the Philosophy Society, and I'd like to welcome everyone else as well. So let me just share my screen to share my slides for this talk. So as you can see in the title, I'll be talking about interpersonal relations in depression, and this is perhaps what drew your interest to come into this session and join the talk. So depression is, some might call it a disease, a condition, a state of mind, however we call it. It affects about 300 million people in the world. And a core aspect of depression is that it affects interpersonal relations. It affects our way of connecting to other people. It affects our way of understanding other people. It affects the way we exist in the social world we are in. So in this talk, I will focus on how social relations are part of our being in the world, of the sense of belonging in the world. And I will try to demonstrate how depression disturbs this feeling of belonging in the world, always with a reference to interpersonal relations. So let me start with saying that I will be taking a phenomenological understanding on depression. That is how depression is experienced from the person that says they have depression or feels that they are depressed or they have been diagnosed as being depressed. And then I will describe how social relations are manifested in depression. But before engaging into the phenomenological understanding of depression, let me start with the current psychopathological understanding of depression. This is mostly seen in the two current manuals we have of the American Psychiatric Association and of the World Health Organization, which define depression in some, I would say, problematic ways. So looking at how the DSM-5 describes depression, in particular the criteria of depression that that a doctor will look at to diagnose someone else with depression. So these are, as we will see in a bit, they fail to take into account the context in which the symptoms occur, and they lack a suitable theoretical psychopathological framework to address human experience. As we will see in a bit, the symptoms that are described that are part of the experience of depression, they ignore or neglect human experience. They don't take into account the context in which the symptoms occur, and they are mostly focused on a third-person observational stance of the doctor or of the medical professional that diagnoses depression. So these are the 9 symptoms of depression that the DSM includes. In order to be diagnosed with depression, one needs to have 5 of these symptoms over a period of 2 weeks or longer. So we see things as like depressed mood or insomnia or hypersomnia, fatigue or loss of energy. There is no mention at all of how interpersonal relations are affected. There is no mention of, let's say, diminished ability to establish interpersonal relations or feeling disconnected from other people. And as I will try to demonstrate today, these feelings of being disconnected from other people are very central and fundamental in the experience of a depressed individual, and yet they are absent from the list of symptoms that a medical professional will use to diagnose depression. Now, I will be making 4 claims in this talk, and I will guide you through every one of the claims. The first one is that second-person interactions are both an enabling and a constitutive condition for the development of the first and third-person perspectives. I will define these terms in a bit, but what I mean by that is that second-person interactions, interpersonal relations we have with other people, connections with other people in general, are central in us developing a first-person perspective that is a self-consciousness, being able to access our own mind and our sense of self, and of the third-person perspective, which is the observational stance that we take toward other people. Now, the central claim here is that we live in a social world, and that it's through the social world that we learn how to conduct ourselves in this world and how to adopt the first and third person perspectives. Now, the second claim is that the ability to establish interpersonal relationships is inextricable from our sense of belonging in the world. That simply says that if we are able to establish interpersonal relationships, that means that we at the same time feel a sense of belonging in the world. And if we lose the ability to establish interpersonal relationships, then at the same time, we also lose a sense of belonging in the world. So these two are inextricable from each other and interconnected. So moving on to the depression side of the things and onto my third claim, I argue that a disturbance in one's interpersonal relations in depression has a direct and simultaneous effect in one's being in the world. And by being in the world, I would roughly say that I mean a sense of belonging in the world, one's existence in the world. So I will demonstrate how feelings of being disconnected from other people, isolated from other people, alienated from other people results in a diminished sense of belonging in the world, in depression. And lastly, I will show that this sense of being alienated in the world, alienated from the world, isolated from the world and other people, has a direct effect in our sense of belonging in the world and results in a disturbance of our being in the world, and that these can be described in spectatorial terms. By spectatorial terms, I simply mean that one feels that they are a spectator in the world, that they are simply an observer in the world. And this can be understood as one is simply observing the world without feeling that they can engage or that they can connect with others. Now, let's give the definitions and look at the first claim. So I'll read the first claim again. Second-person interactions are both an enabling and a constitutive condition for the development of the first and third-person perspectives. So what do we mean by these perspectives? The first-person perspective is the subjective or the experiencing perspective. It's what we mean when we say, I experience, I think, I'm thinking. So it's whenever we use the I, whenever we have some sort of self-consciousness, some sort of access into our own mind state. The second-person perspective is the intersubjective. So that means that it's about our connections with other people. It's the participant perspective, it's the co-experiencing perspective. perhaps we can put more emphasis on the co-experiencing side of this, that it involves relations which are characterized by a co-experience, experiencing something with another person. Some examples are watching a movie or seeing the sunrise with another person, or just walking around town. These all are examples of the second person perspective, or even some simpler interactions, such as a conversation with another person. The conversation between two people is intersubjective. It involves two subjects which interact with each other. And as the definition says here, there is a reciprocal interaction. That means I say something and I expect the other person to reply. So there is some sort of two-sided interaction there. And the third person perspective is, as I said earlier, the observer perspective, where there is referring to situations of one-way remote observation of others, or to situations of talking or thinking about absent persons. But in this talk, I'll mostly focus on one-way remote observations of others in regard to the third person perspective. So adopting a third person perspective is a remote, almost detached observation of others without engaging at all with another person. In the possibility of engaging with another person, then we need to employ the second person perspective. So getting more into the argument I'm trying to make here. Second person perspective interactions are present from the very beginning and are the primary means through which we attain self-consciousness, that's the first person perspective, or other consciousness, that's the third person perspective. From infancy, we do not exist as self-contained entities, but as a self with others. So we come into the world, but from our very first moments in life, we learn about the world through interactions with others. Studies have shown that infants or newborns, from the very first minutes in life, they respond to sounds, they follow the gaze of another person. A few weeks later, they're able to direct their gaze onto objects in which their carer also directs their gaze. So there is a sense in which infants or humans, from the first days or weeks after birth, we are a self with others. We come into the world, but this is always in the sense of being in a social world in which others also exist. And it seems that it is through these interactions with other people that we learn about ourselves and we learn how to observe others. That's the first and third person perspective. So by claiming that second person perspective interactions have a primacy over the first and third person perspectives, I further aim to show that interpersonal relations are fundamental in our sense of belonging into the world, because it's the way we learn about the world. And this can happen in many kinds of interactions. Dyadic interactions, this just involving a newborn and its carer. Triadic interactions, as you can see in the picture here, that involve the newborn, their carer, and another object in which they focus their gaze. And there is also the involvement of the mirror neuron system. That is, that when I observe someone performing an action, our brains activate in the areas that activating some areas as if we are doing that action ourselves. And we can see that in newborns, that it happens in newborns as well. That means that we come ready into the world, ready to interact with others, and having the necessary equipment to interact with other people before we can even say that we have self-consciousness. So, as Moll and Meltzer say here, infants come to learn about the social world not from he's and she's, whom they observe dispassionately from the outside, but from youths with whom they interact and engage in collaborative activities with joint goals and shared attention. So it's only when an infant can relate to another person as a you, in a second person way, rather than in a he or she, which involves a third person perspective. They don't learn from observing others, but from engaging with others in certain activities. So we could say that we're never an isolated I in the world, but always a being with others, a self with others. We always exist with other worlds, with other people, in the world. So a very good point that Merleau-Ponty makes here. So the I arises when the child understands that every you that is addressed to him is for him an I. That is, there must be a consciousness of the reciprocity of points of view in order that the word I may be used. So what this means is that the I attains its full meaning not only when it establishes that I am an I for myself, but I am a you for others. It's not enough that I establish that I am, but also that I am a you for you. And in an interaction phenomenology, phenomenologists would say there are always two I's and two yous. I am an I for myself, but I also see you as a you, and you do the same. Now, which are the differences between the second person perspective and the first and third person perspectives? Or in other words, which are the constitutive and defining aspects of the second person perspective? I would argue that it's just three things. Reciprocity, that when we exhibit a behavior toward another person, when we say something, when we act, we expect a reciprocal action in order to develop an interaction. There is interaffectivity, or in other words, this could be taken to mean the ability to affect and be affected. So in an interaction, in a successful interaction, there is always this sense of being able to affect the other person and be affected from the other person. If in a conversation we see that we are only able to affect the other person, or we are only able to be affected by the other person, then there seems to be in some sense that the conversation is lacking or the interaction is lacking somewhere. So for successful interaction, I argue that there needs to be both the ability to affect and be affected from both sides. And the third criterion, or the third defining aspect of the second person perspective, is a sense of others as persons, as subjects, as persons with whom we can do all sorts of things that we do with people, read poetry, walk with them, engage in meaningful conversations, things we cannot do with objects. And this, as we will later see, is something that is lost in depression. Depressed people don't retain so much the sense of others as persons, as subjects, which offer the possibility for interaction, and thus there is a disturbance in interpersonal relations. So what do we mean by a sense of others as persons? Let me elaborate on that a bit. So imagine you're in London and you go into Madame Tussauds and you see this figure of Benedict Cumberbatch. And you can do some things with this inanimate figure. You can take a selfie, you can brush his suit. But there is just a limited sense in which you can interact or that you can act towards this figure. It's just an object. There's only limited things you could do with it. But at one point you realize that this is moving. It was terrible. That this figure moves and it's actually the real Benedict Cumberbatch, and he likes to play a prank on people. So he moves and it shows that it's actually the real actor, the real him. So at that moment of that the actor, that Benedict is moving, there is an immediate existential shift that happens in our understanding of the world. So we see the figure as an object. We recognize the very limited things we can do with it. But at the moment that he moves, we recognize him as a whole other existence. So he makes all kinds of possibilities open to us. So we recognize him as a person, not as an object. And recognizing him as a person means becoming aware of the potential to alter each other's world. We cannot do that with an object. We cannot alter the world of the object. And perhaps we could discuss what the world of the object is. And it's questionable whether that object could alter our world in the same extent that a human being would. And with the real Benedict Cumberbatch, we can develop and establish a relationship which is defined by reciprocity and interaffectivity. When it's just the inanimate wax sculpture, we might try to take a selfie or do some things with it, but we don't expect any reciprocal interaction from it. So that is what we could say that defines someone as being a person. So moving on to the second claim. I argue that the ability to establish interpersonal relationship is inextricable from our sense of belonging in the world. So a sense of the world as being real is accompanied with a sense that it remains the common life world. But the common life world is, we can say that means that it's the world we all live in. So the real world is the common life world. And the interpersonal aspect is not to be understood or construed as an add-on to an already experienced interpersonal world. The world is interpersonal. There is no aspect in which there is the world and then there is an add-on to the world which makes it interpersonal. No, the world is the interpersonal world, is an interpersonal world. And is in its very nature fundamentally a social world in which we always coexist with others. And we could then say that a sense of the world as being real and accessible is inextricable from our ability to form meaningful interpersonal relations in that world. So if we lose the ability to establish meaningful interpersonal relations, then at the same time, we lose a sense of the world as being real or accessible. And in the other way around, in the other way too, that if we lose a sense of the world as being real and accessible, then that means that our ability to establish interpersonal relations is diminished to some extent. So what I want to argue here is that when we feel that we belong in the world, that means that we also feel that we can establish interpersonal relationships. That's how fundamental interpersonal relationships are. They are so fundamental that in their absence, or in our diminished ability to form interpersonal relationships, we also lose a sense of belonging in the world. And let me share with you some aspects of Edmund Husserl's philosophy. Husserl was the founder of phenomenology. So Husserl understands the social world as a world shared primarily with other human subjects. And that's what he says. Each I, the man, and all of us together belong to the world as living with one another in the world. And the world is our world, valid for our consciousness as existing precisely through this living together. This is true not only for me, the individual ego, rather we, in living together, have the world pre-given in this together, belong the world as world for all. So in the world we are living together, it's never that, as he says, I, the man, I, the person, is living on their own without other people or without being affected by other people. He very clearly says that the world is our world, and it becomes valid through living together. So you can see how in phenomenology there is this understanding that living together is inextricable and connected to a fundamental level with a feeling that we live in the social world. Now let's look at how that is manifested in interpersonal relations a bit. And I continue with Husserl. When I seek to influence the other, and the other is aware that he is being addressed and reciprocates, and when both of us become aware that we are being experienced and understood by the other, we are dealing with communicative acts through which a higher interpersonal unity, a we, is established, and through which the world acquires the character of a truly social world. So there is this sense that when we interact with another person, the interaction takes a higher form. It's not that I talk to you and you talk to me and that's it. There is a sort of a we talk. We talk to each other. We form a conversation. We have a conversation. When a couple watches a movie, it's not that the one person says I watch the movie and the other person says I watch the movie, but there is this higher interpersonal unity that we are watching the movie and we are enjoying the movie together. Feelings such as enjoyment or happiness, they're not only feelings that can develop in the first person sense, but in the second person sense as well, that we feel happy, we feel grief, we feel sad, we feel joy. So there's a very basic, very central sense in which the world is a social world, which gives the opportunity to us to develop these interpersonal relationships that are defined by a sense of we. So the world is our world, as Husserl says, and is continuously defined through our interactions with others. As I argued earlier, these interactions are defined by our capacity to reciprocate and to affect and be affected. And of course, that involves a sense of others as persons. So being in the world, a sense of belonging in the world, means being with others, existing in the world with others, having a sense of belonging in the world. But that's not simply a sense that I belong in the world, but I belong in the world with other people, as you can see in the picture here. But I must say that the picture might be a bit misleading, but because being with others, belonging in the world with others, it doesn't always mean that we exist in the world physically with others, that we exist in a crowd or in a place where we have neighbors or we go out and see people. It goes beyond that. It means that when we come into the world, we are already shaped by societal standards, by tradition, by history. And tradition, for example, it has been shaped by other people. When we go out, even if there is nobody in the streets, we feel a sense of that we need to behave in a certain way and not break social norms. So it's not a sense of there having to be other people physically around us, but this sense of needing to adhere to some social norms and follow certain traditions or customs. It shows that we live in a world with others. Now, moving on to the third claim. A disturbance in one's interpersonal relations in depression has a direct and simultaneous effect in one's being in the world. Let's see what that means. So I argue that if being able to establish meaningful, reciprocal, and interaffective relationships with others as persons is constitutive of our sense of being in the world, it follows that a disturbance in our ability to establish interpersonal relations has a direct and simultaneous effect in our being in the world. So if the first two claims are true, and if second person interactions are so fundamental in how we learn about the world, and if interpersonal relations are so inextricable from and so connected to our sense of belonging in the world, then it follows from that a disturbance in one's interpersonal relations has an effect in how we feel that we belong in the world. And I argue that this is the case in depression, that this felt sense of our interpersonal relations being disturbed and being unable to establish meaningful interpersonal relationships with other people has a direct effect in how we feel that we belong in the world. And we'll see that some central aspects of the experience of depression are feeling alienated, feeling isolated, feeling incarcerated from the world. So fundamental is the second person perspective in our sense of belonging, that, as Thomas Fuchs has said here, in a world in which the possibility of connecting with other individuals disappears, the sense of reality dissolves. Try to think about the weight of that phrase, or how heavy, how deep that sentence sounds. The sense of reality dissolves. That's not something that we can say for any kinds of experience, or for at least many kinds of experiences. So there's something unique about depression and some other pathological conditions such as trauma and grief, that they are accompanied by a sense of reality dissolving. And this is, according to Thomas Fuchs here, and I agree with him, that this is connected to a diminished sense of our ability to connect with other individuals. So let's look at a few testimonies from of depressed individuals. I can feel very paranoid and unsafe, like I'm on the verge of being attacked, mocked, the subject of any kind of negative attention. I try to avoid people as they seem angry and irritated at me and like they don't want me around. I feel like a burden to others. I find it extremely difficult to trust anyone. It feels like they all have guessed that there is something wrong with me, and now they're all conspiring to get me sorted out. When I'm depressed, strangers scare me. I trust no one. So it's this sense of people being scary. It's this sense of people hating the depressed individual. This sense of people of not being possible to connect with others because they look so angry at me and irritated at me, and so and I feel that, and the depressed individual feels that they will get attacked by them. And the world seems alienating as well. Sometimes I feel the world has departed from me, and I look at people on streets or at cars passing by like they were scenes from a movie. This is exactly what Fuchs says. There is a sense of reality dissolving. It's like we're not living in a real world anymore, but in a movie. I feel like I'm watching the world around me and have no way of participating. That's the sense of adopting a third person perspective, a sense of being a spectator in the world. It's like I'm watching a play, or it's like I'm watching a play and I have no way or opportunity to engage in the play or take part in the play. And there's also this sense of the lives of other people just going on while mine has stagnated. This is another aspect in which the depressed individual feels alienated from the world, because they can understand that life is not as it should be, or as it could be, or as it used to be. And they can see other people just keep living their lives as normal, as they used to. So this is another sense in which a depressed individual may feel alienated from the world if they cannot do the things that other people can. And as the previous quotes we saw, they have a sense of the world as a frightening place full of people who are bad and threatening. So I don't think anyone could imagine that it's possible to establish interpersonal relationships in a place in which people are bad and threatening. And that place is frightening as well. So other people, instead of offering the possibility to engage in reciprocal and interaffective interactions, are perceived as threatening and less trustworthy, offering minimal possibilities for meaningful interactions. So let's revisit the defining aspects of the second person perspective, or the interpersonal interactions that I said in the beginning. The first one is reciprocity. There's a sense in which the sense that there can be reciprocal interactions is diminished in depression. There is a sense in which others cannot understand the depressed individual. This is something very common in testimonies or autobiographies of depressed individuals, that they say that others cannot understand what they feel. They say that they cannot find the words to tell other people how they feel. So if one expresses their feelings or how they feel, but they also have a feeling that other people don't understand them, then there is no way in which that interaction can be reciprocal, because in the first place, there is the sense that other people don't understand or don't grasp what's in the mind of the depressed individual. And also interaffectivity is also diminished to a certain extent, because experiences of depression are accompanied by a certain sense of numbness, of not being able to affect other people as much, or be affected by other people as much. Or if depressed individuals could still be affected by other people, and I'm not arguing that the feeling of being affected is totally absent, but what changes is that they can still be affected, but in a negative way. All the descriptions we saw earlier as of people feeling threatened by other people, or that other people are bad or scary or frightening, well, these are still ways of connecting to other people. They are still ways in which the depressed individual is affected by other people. But they are negative. They're in a sense negative. They have a negative connotation. We can't expect a depressed individual to connect with someone who looks bad, threatening, or frightening. And the sense of others as persons also diminishes. There are two diseases which are prevalent in, not prevalent, which appear in some depressed individuals. That's the Capgras delusion and the Cotard's delusion. The Capgras delusion, depressed individuals who develop Capgras delusion, they think that other people are imposters. And this mostly happens with family members. They think that their mother, their father, or their sibling is not the real parent or sibling, but that they have been replaced by someone else. And the Cotard's delusion says that the Cotard's delusion is a sense in which the individual feels that they are dead, or other people are dead. So again, we can't imagine or expect an individual who sees their sibling or their friend as an imposter, or they think that they are actually dead, to establish an interpersonal relationship with them. And finally, and coming close to the end, let's see how what I described can be described in spectatorial terms, what it means to be a spectator in the world. And a very good book, perhaps one of the best autobiographies in depression, is this one by Sally Brampton, Shoot the Dumb Dog, a memoir of depression. So Sally Brampton says, life is about connection. There's nothing else. Depression is the opposite. It's an illness defined by alienation. So she says what phenomenologists say as well, that life is about connection. There is no life without being able to connect with other people. And this is the sense in which depression is the opposite from life, but also opposite from connection, and is defined by alienation. So let's investigate this spectatorial stance a bit more. So the second person perspective, as Schilbach et al. Say here, involves directly interacting with and emotionally engaging with others, rather than simply observing them from a distance. Thus, the second person perspective is contrasted with what is called the spectatorial stance. So they recognize the spectatorial stance as being the opposite of the second person perspective. It's the third person observational perspective. And that's what I argue that depressed individuals adopt. So in becoming a spectator, then, the depressed individual adopts a detached third-person perspective, which is, as Thomas Fuchs, I'm using Thomas Fuchs' definition here that we saw earlier at the beginning, it's a one-way remote observation of others. So the depressed individual feels that they simply look at others from a distance. And it's a one-way interaction. They expect no reciprocity, no interaffectivity. And quoting again Schilbach et al. Here, in the spectatorial account of cognition, we are adopting an attitude of detachment from others rather than emotionally engaging with them. And we're merely observing people rather than interacting with them. So there is a sense in which depression could be, in some cases, described in spectatorial terms, having a sense of detachment or merely observing others. And a good analogy, although not accurate, or sorry, let me say that in a bit. First, let's look at some other testimonies. I feel like I'm watching the world around me and have no way of participating. I feel disconnected from the rest of the world, like a spectator. These are real testimonies from depressed individuals. Sorry. I feel like the world is happening around me and I'm standing still, almost like in a haze. It seems like there is a barrier between me and the outside world, as if everything is more distant. So all these descriptions demonstrate that the depressed individual could be described as a spectator in the world, like they are watching a play, although it's not a totally identical experience, or not an excellent analogy. It's in many ways that it could be described in these terms. Like I'm watching a play, like the depressed individual is watching a play, and that they cannot engage with the actors while they're watching the play. They cannot step on stage and just interact with the actors. If there is a glass of water on stage, it seems that the possibility of them going on stage and drinking the glass of water is non-existent. And this is how depression has been described as well, like watching, being thirsty and watching a glass of water, but being unable to go and drink from it. And this sense of watching a play is something that Brampton also looks at, Sally Brampton. So it looked to me like a scene from a play that I was witnessing. I could not say that I was even engaged enough to be watching it. Any focus was absent. So this sense of being a spectator keeps emerging in experiences of depression. And some other descriptions by Thompson. I didn't know what was standing between me and deep connections with other people, but that was there too. I felt it distinctly. It was a wall. I couldn't get around it or over it. It was just there. So there is a sense in which some depressed individuals feel that there is something disconnecting them from other people and from the world. And that because there is this thing, let's say, between them and the world, they feel that they can only observe the world from a distance and not reach the world. So, given the definition of second-person interactions that I talked about earlier, the experience of depression may involve an inability to establish reciprocal and interaffective relationships, a diminished sense of others as persons, and a diminished sense of possibilities. And possibilities, we could understand that things we can do in the world, like go out for a drink or go for a walk. These are, in the mind of the depressed individual, almost impossible, or they feel that it takes so much effort to do anything, to get out of bed, make a cup of tea, go out, that everything requires effort and energy. And the spectator analogy also comes from Sylvia Plath as well. I felt as if I was sitting in the window of an enormous department store. The figures around me weren't people, but shop dummies, painted to resemble people and propped up in attitudes counterfeiting life. So there is, she says it right there. The figures around me were not people. So there is an almost not just a diminished sense of others as people, but a complete loss of others as being people. Other people just look like shop dummies. And as we saw earlier with the example I gave, there is only a very limited way in which we can interact with wax figures or shop dummies. But that's how a depressed individual might feel when they encounter other people. So if one looks or perceives other people as shop dummies, then there is no way in which they could interact with them in any meaningful sense. So I'm coming to the very end now. Alongside the aforementioned aspects of the experience of depression, the patient may also have a very implicit awareness that the world is not as it should be or as it used to be. So this is accompanied by a sense of being alienated, incarcerated, isolated from the world. When the depressed individual sees something and they recognize that it's not as it used to be, there is a felt sense that they are being detached or alienated from that thing. And there is also a felt sense that other people are able to access and actualize the possibilities that the world offers. It's not that depressed individuals are totally isolated or alienated from the world, but when they see other people just getting on as normally with life and getting on with their routines and going out and having fun, when they observe that and they think that they cannot engage with those people or connect with them, then this further alienates them from other people and from the world, because they cannot access the world that they observe. So it's in this sense that I argue that one is alienated, incarcerated, isolated, estranged from other people and from the world. And given how fundamental our sense of belonging in the world is, it follows from that if our ability to form interpersonal relationships is lost, then our sense of belonging in the world is also lost. And this, I argue, can be described accurately using the spectator analogy, that one is an observer in the world, and they are simply observing the world from a distance. Thank you very much.
Right. Thank you for your talk, Angelos. That was very interesting. Anyone that wants to ask a question can either write them in chat, or you can ask me to unmute you if you would like to ask him instead directly. I have a question actually. When you spoke about the distinction between negative and positive interpersonal relations, it seems to me that whenever you spoke about sort of this subsequent disconnection, this feeling of being disconnected, was always a negative thing. And I wanted to ask you if you thought that maybe there were times in a person's life where that wouldn't sort of be a bad thing to do. Like, say you're in a situation where everyone around you is, you know, are bad people, then surely it would be a good thing to sort of try and disconnect from that environment,
Mm.
maybe for a short period of time.
Mhm.
What do you think about that?
Yeah, that's a very good question. I would say you are absolutely right. And this goes back to our understanding of depression, about what depression is. And I think it's a mistake to say that depression is just an illness of the self, or that an illness that exists in the individual. It's something that we could understand as existing in the environment or in society. If there is, if I'm feeling depressed, then there is nothing necessarily wrong with me, but it could be that there is something wrong with my workplace, or the university I'm in, or with my family, or something in my environment. So, as you say, this, if I get the sense that I have bad people at my workplace or at my neighborhood, and this causes me depression, then that could be a sign that I should leave this place. I should leave my workplace. So it's certainly not a bad thing if uh, if if life gives me the signs that uh, there is some threat in the world. So I need to leave this environment, and that there is nothing that I should fix about myself, but that I should change the environment in which I find myself in. Great question.
Okay, thank you. I can see Callum has a question he's written. I don't know if you want to read it yourself,
Yeah.
or I can read it for you. Doesn't matter.
Yeah. So with this categorization of depression as a spectator, is there any new or improved way of tackling, of treating the depressed person? I would say that we should give the focus on establishing interpersonal relationships, or re-establishing interpersonal relationships. So if the disturbance in interpersonal relationships causes someone to be depressed, and their illness or their experience of the world being be labeled or be described in spectatorial terms, then it could be that the developing some interpersonal relationships through psychotherapy, or through changing the environment in which one finds themselves, then this could certainly be a way for treatment. And there are special and specialized ways in which the focus of therapy is on interpersonal relationships. And I would say that if the therapist realizes or understands or interprets the experience of the depressed individual as being a spectator, then this could add to something to their treatment of that person.
Okay.
I have a question.
Of course.
Thank you very much for speaking. So far, I mean, everything you said has logically followed from what came before. So my question is, the fact that this is so blatantly omitted from normative descriptions of depression, do you think that's some sort of logical gap in the reasoning of therapists and of mental health scientists, or do you think it's a fundamentally different interpretation of depression to what you see that results in a different description?
Yeah, I would say it's the second thing you said, that is something that it's their understanding of depression is fundamentally different. Perhaps fundamentally would be too strong of a word, but that the current understanding of depression is to some extent flawed. And the examples I gave were from the American Psychiatric Association. So we cannot ignore the effect that culture may have in the development of such manuals. I know they take insight and advice from therapists and from doctors and psychopathologists from all over the world in developing this manual. But there is a sense in which there is too much focus put on the individual in the symptoms that are presented in the manual for diagnosing depression. Whereas in other cultures, especially in Eastern Asian cultures, depression is not that much understood as an illness of the individual, but to some extent is described as something that is it's felt in the atmosphere. That's how they could describe it, or it's an illness which exists between people or in interactions with others or in society. So there shouldn't be, we shouldn't understand depression as something that's could only be wrong with the individual, but it could be that it's the society that they live in. So I would also invite I would also welcome some non-Western or non-Americanized, I would dare say, understandings of depression, which see depression in other terms as well, and not simply as whether the individual sleeps a lot or eats a lot, or they find themselves in sort of a depressed mood. And the latter, what I said, that the first symptom that the DSM-5 mentions is depressed mood, but it's a bit paradoxical, I would say, that one of the symptoms for diagnosing depression is depressed mood, because it's never explained what depression is, if one of the symptoms for diagnosing depression is depressed mood.
Yeah. I feel like I have a lot of questions if I think it through, but I'm struggling to sort of formulate them, to be honest with you. So does anyone else have any questions for Angelos? Okay.
I have just another quick question.
Mm-hmm.
You mentioned that the part of the symptom of depression is believing in a limiting factor on your ability to affect others and others affect you. Does this extend to non-human entities like animals? Can you still, would someone with depression still see those as objects, or would they see them as people?
To be honest, this is not something I've looked into, about how depressed individuals see other objects or non-human animals. So it's something that I should look into in order to provide an answer. The answer is I don't know how depressed individual would look at non-human animals, or if they would see them as still offering the same possibilities for interaction. I would imagine that there could be a diminished sense of what one could do with an animal or with objects as well. Some depressed individuals describe objects in a sort of that they're looking fake, or that they cannot see their function when they look at objects, or the object itself could serve in reminding the depressed individual what they cannot do. So in some testimonies, people say that they might look at a cup, and that reminds them how difficult it is for them to make a cup of tea or a cup of coffee, because it's actually really difficult for them to even make a cup of tea. It requires a massive amount of and this happens with other objects as well. So to an extent, it could happen with non-human animals as well. That's a great question.
I actually have one more question. It might not be very relevant to exactly what you were talking about, but it's definitely about sort of depression, the topic of depression. And I wanted to ask you, what do you think about, I don't know what to call them, but they're sort of, they're more like sense-based treatments to depression, and no anxiety as well. For example, like shocking your body. It can be, say, taking cold showers, etc. All these sort of ways of shocking your body. What do you think about those?
I don't know about those exact methods of therapy that you're referring to, but from what I got, they involve the body as a central element. So they try to they're targeted towards fixing the body or treating the body. Is it right? So that's actually a whole other chapter in my thesis, how the body itself is affected in depression, and how this serves for someone to be alienated from other people. So depression is not just, as it's understood in phenomenology, it's not just a disease of the mind, but also a disease of the body. It's something that is felt. So certainly in treating depression, there is also a sense in which we should look to treat the body, and not just talk with the patient or offer some counseling. It's not just the mind that needs to be talked to, but the body as well.
Yeah, because I was also thinking that it certainly is compatible with your theory, because the whole disconnection thing you're talking about. So in the case of cold showers, for example, the subject is sort of forced to be in that moment in a way. It's certainly very difficult, I would imagine, to sort of get out of, because you have sort of this sensory overload that you can't really get out of, and then you're sort of forced to be in that moment, as opposed to drifting off in your thoughts. So
yeah, absolutely. There is the sense of one being depersonalized is very prevalent in depression as well. So something that tries to revert that feeling of being depersonalized by making one present in the moment, that would certainly help in treating them, I would say. Or more contemporary approaches to treatment, which are not really contemporary, but they just became more known. That being mindful, being in the present, having an awareness of your own body and state of mind, these have, I think, they have been proven to work in patients with depression.
okay. Very interesting talk. I really enjoyed it. I'm sure everyone else did.
Thank you very much.
So yeah, if no one has any more questions, I just want to thank everyone, sorry, for coming, and especially you. Thank you for your talk.
Thank you very much. Thank you very much for inviting me. Thank you to everyone for being here. And well, best of luck with the society and with your studies.
Thank you.
Thank you very much, everyone.